It's been a struggle for 9 years now. My cancer care costs probably about $250,000 a year. Insurance does not pay for everything. I'm paying about $10,000 to $15,000 a year in medical expenses, and that's a major hardship for me. This stress and anxiety over paying for life-saving treatments is horrible. I do need assistance from my family, and I've known women in my cancer support group who don't have any assistance from anybody. And one woman, her drug copay per month was $1,000. Could be a life-saving drug, but she can't afford it. So what does she do?
We don't discuss out-of-pocket expenses, and yet absolutely there is a very high percentage of patients and families in this country today who exhaust every dime of their resources just trying to pay for even a co-payment of their cancer care. And often the outcome will be that the cost invested was not even helpful. So patients are also spending money on treatments that are not going to alter the course of their disease.
Recently, my insurance company changed my mail-order pharmacy provider. And I asked them about my coverage for this cancer drug. So the customer service rep gets on the phone and he goes, "Oh, it's $15,000 for a 3-month supply." I'm like, that's ridiculous. It can't be. He goes, "Well, we don't have you in the system yet for what you're covered for." I was extremely upset and stressed out.
Right now, there's no transparency in the cost of cancer care. The doctor doesn't actually know it. The patient doesn't know it. In fact, until you submit a claim, you don't even know what the insurance company is going to pay. There's nowhere else in our purchasing or our interactions where that happens. You know exactly what it's going to cost. You go to the car dealer and they give you an estimate. We don't have that. In the future, we would like to have the ability for a patient to compare costs of the types of procedures that are being offered to them, and perhaps even across different institutions.
The specialist who was suggesting throwing everything at this cancer, my cancer, never said anything about the price tag. I need to have financial transparency. I don't want to go down a road that's a $500,000 road that doesn't give me any value. I want to go down the least expensive road that gives me the most value. And I think it's a consumer right that I get that information.